Good afternoon, everybody. It is officially 12:30. We are waiting for two more members of the board to have a quorum. And as soon as they come on, we can do that. In the meantime, we can make an announcement. We'll go through the rank and file. Hey, Dr. Chuck, see you there. We'll go through and announce, put some light on so I don't look too ominous. We'll go through where you are and what have you. Bobby, would you like to start, please?
Yes, so this is a public meeting held via Zoom. According to the Governor's Safe at Home order, the Zoom link was sent out and posted at City Hall as well as at the library. The meeting ID is 863-9978-9686 with a passcode of 271193. And if folks are joining by phone, the number is 1-646-876-9923. The meeting is being recorded. And then Dr. Sturris, if you wanted to do the roll call for the Board of Health members, we can do that. And it would just be the Board of Health members.
Right. Tony Sturris, I'm here at my house alone. I can hear everybody, and I hope everybody's enjoying this virtual meeting. There'll sure to be some snacks, so we'll get through it. Dr. Chuck?
Oh, good afternoon. Chuck Capetta, Board of Health member. I'm at home. No one else is here, and I can hear everybody. Thank you.
Okay. Dr. Stephanie? Okay, I know Stephanie said she was going to be with a patient, and she also had to cut out at 1:30 because she has another patient. We do have two members, so we do have a quorum, 2 out of 3. So I'd like to open the meeting if that's okay. And the first order of business is to approve the past minutes of November 24th. Chuck, would you like to start that motion?
Yes, I'd ask that we approve the minutes of November 24th. Yes.
Okay, I'll second those. Those in favor?
Aye.
Stephanie, back?
I'm here. I just said.
Okay, all right. Okay, thank you. We've approved the minutes. We're moving forward on item number 3, discussion of the 9:30 curfew, and I've got a sneeze, so I apologize in advance. Stephanie, would you like to take the lead on that, please?
I'm sorry. Which discussion are we having?
9:30 curfew.
Oh, we discussed this. Could somebody please mute there? Could everybody that's not talking please mute? We discussed this extensively at the last meeting. We agreed on a number of principles, I believe, that I'd like to outline, and then I would like to open it for discussion and for a recommendation. 1, the burden of COVID in the community is high and growing. So something has to be done differently than what we're doing now. The second thing is that there are 4 proven techniques to reduce the burden of COVID. One is masking. The second is social distancing. The third is hand washing and alcohol-based hand sanitizer. And the last is ventilation. I will qualify ventilation by saying either you're outside or you're in an environment where the number of people per square feet and the ventilation of that space match so that there's good air circulation and the aerosols, which we know are the main mode of transmission, are dispersed quickly, and the burden of aerosols is matched to the ventilation. Curfews in and of themselves are not at this time proven to reduce the burden of COVID in a community. So the alternative to a curfew is strict adherence to those principles that I just outlined. What we heard at the last meeting is that there is not strict adherence to those principles. Now, prior to the last meeting, we had a city and not a state mandate for masking, which made it more complicated, but now we have a state mandate. And that mandate includes children 5 and above. So if something has to be done, and due to whatever circumstance, the business leaders of the community and the collective wisdom is that it is not feasible to enforce masking in indoor spaces. It's not feasible to have social distancing. It's not feasible for the ventilation of certain environments to match the number of persons. Then reducing the number of hours of exposure in those environments is the only alternative. It's not the preferred alternative, but it's an alternative. So I'll stop there, and I'd like to hear what my colleagues on the board and my colleagues in the public health department have to say.
Okay, Chuck, ball's in your court.
I agree with Stephanie that the curfew is hard to enforce. And I think we're just in this sticky wicket mucky muck. I said last time that we're trying to figure out how best to proceed. So the reduction of hours, therefore the reduction of exposure makes sense to me. It's just be curious to see how the public responds to that, given how hard it is even in our own offices to get them to abide by the rules. So I'll leave it at that for now. I'll have more later.
Thanks, Chuck. Stephanie?
Can I just clarify something?
Certainly.
We're talking about a 9:30 curfew. We were previously speaking about restaurants. But one of the details that was discussed last time is if we're truly concerned about the burden of COVID in the community due to the consequences, not just for the elderly population, but for those who get it, long-term illness, as well as, the hospital's ability to care for those persons. It's not just about the restaurants. It's about other venues where there are indoor environments where there's eating, drinking, lack of social distancing, and lack of adherence to masks.
Oh, agreed. That's true.
Okay. I'd like to get some comment from Ren and Heidi. I'm not sure if Heidi's on. I only can see some of you. Ren, can you discuss specifically what Stephanie's talking about, the ventilation and the separation of potential problems?
Yes, hi. Hi, everyone. This is Ren Boder in Environmental Health. I just wanted to clarify some of the discussions that have happened in the past. We do know that there is an airborne aspect to this virus. It has been shown that it can survive in the air upwards of 3 hours or so after, before the virus can die and or land on other surfaces, which can also then transmit at that point. So there is a concern in crowded spaces that this virus can linger and spread during those times. And we also know that a barrier that is allowed to be placed, for example, in a restaurant in between booths or in between tables to reduce the requirement to social distance is not a effective means to cut back on that aerosol, right? So the smaller droplets will go up and over. And then you could also be creating a miniature indoor space that can trap some more air. So there's really no science there to dictate that barriers or those barriers are safer in terms of reducing the requirement to social distance. So increasing the rates at which we can ventilate and which we can filtrate air is certainly an excellent way to reduce that particulate load that could be sitting in the air. So by increasing the rates of HVAC systems inside of workspaces, inside of retail stores, and inside of restaurants, as well as upgrading the filters of such systems to a higher rating that can capture those extremely small kind of particles, is certainly a way to improve the air quality as an additional measure, as was mentioned, to the masking, the social distancing, and the hand washing.
Thank you, Ren. Is Angela here by any chance, Bobby?
Yes, Tony, Angela is here, and Angela can give an update on the global numbers, national numbers, and what we have statewide and locally.
Yeah, Angela, I'd like you to maybe address the trends. Are we going up? Are we going down? Are we treading water? What are you seeing in your numbers?
Sure. So we've definitely been increasing steadily since the end of August. So in regards to our substantial community level transmission numbers, we've been increasing over the past 3 or 4 months in regards to our incidence rate. So over the past 14 days, we've had 669.2 new cases per 100,000 people. That's up more than 150 cases compared to last week. This past week, we also moved from moderate to substantial in regards to the percent positivity category. So our percent positivity rate is 11.1%, which is up about 5 percentage points from last week. For comparison, the state's percent positivity rate is at 9.2%. And then we're still considered minimal in regards to new hospitalizations. We've had 2.2 new hospitalizations per 100,000 people over the past 14 days. Then in regards to our cases, last week in Nashua, we've had 341 new cases for an average of 49 new cases a day. This is the highest case count we've had in a week since the whole pandemic. Of our 341 cases, 111 of those cases were not contacted due to our updated criteria. There has been a cumulative total of 2,453 cases in the city of Nashua, and 593 of those cases are currently active. We've also had 2 additional deaths in Nashua over the past week for a total of 42 total deaths and a case fatality rate of 1.7%. Our hospitalization rate in Nashua is at 3.8% compared to the state's rate of 3.1%. And this number has remained steady over the past few weeks. And then just in looking at Massachusetts, they're also seeing the same kind of trends that we are. They're reporting between 4,000 and 5,000 new cases a day. Their hospital activity is up. And their percent positive curve is also up. And then in regards to the rest of the country, the West Coast, Southeast, and New England states continue to see increases in their curves, while the Midwest is seeing a bit of a decrease in the number of new cases per day.
Thank you, Angela. Is there any other comment as far as the board members are concerned? Stephanie, Chuck?
No, the data is just, Angela just said, this supports what we're talking about. It's just getting worse with each passing day, as we all know.
Okay. Stephanie?
The only comment I will, a few different things, because I'm watching the trending on the chat. Obviously, this has generated a lot of interest. We have quite a few participants on this call. Whatever decisions are made by the aldermen in the city. It's the Board of Health's role to make recommendations based on the information that we have. And one of the things we spoke about last time was whatever decisions are made, whatever recommendations are made, we should make sure that people understand why those decisions and why those recommendations are being made. As discussed at the last meeting, there has been an evolving science and statistics around coronavirus and coronavirus transmission and coronavirus illness. And Ren has provided us with some of that information, as have others. But there are some things that are very clear now. And I do not believe that everyone in the public recognizes the data on masks, recognizes the data on the long-term illnesses it can cause even people with no prior medical conditions including obesity, but also that while people think of those with vulnerabilities, whether that be cancer or asthma, arthritis, diabetes, that the prevalence of all those illnesses, whether it's in children, in middle-aged persons, or in older persons, is a significant portion of the population. And I would just ask that whatever recommendations and decisions are made, that accompany them so people can have an opportunity to understand.
Thank you, Stephanie. I think I saw Bobby's hand up.
Yes, thank you, Dr. Sturz. And I'm very glad to see we have so many folks on board for this conversation, especially from our businesses, to hear the data, hear from a public health perspective, what we're looking at with regards to how we can together, collaboratively as a community, look at addressing the issue of what we're seeing currently with COVID, the spread, and the impact on our community. And we opened this up and invited, our community is our partner, right? The city's health and well-being, the public health and the protection of the public's health is not just regulated to the public health department, but it's all of the citizens together. It's society's responsibility as a whole to look out for the health and well-being of the community and of the public. So I'm glad that we have so many folks here, and we will have some time for public comment. From a public health perspective, when we look at this data and we look at what we're seeing currently right now and what we're hearing from our hospital partners, the substantial spread is impacting our community at a significant rate at this particular time. We usually have a weekly call with our hospital partners, and we are learning that the hospitals are now beginning to become impacted by what we're seeing in our community. And although we have a majority of individuals that have mild illness, we have a significant number of folks that are actually now being seen and admitted into the hospital. Angela shared the data of the deaths. We haven't had a death in Nashua in months. But because we now have significant increase in infection and virus, we're also now starting to see the number of deaths increase in our community. Our long-term care facilities were not being impacted as much as they are, and now they are. Once again, the virus is trending up in our long-term care facilities. When we see these types of activities occur in our community, it increases the risk of death and morbidities impacted by COVID because of the increased exposure. Our decision to have a conversation about the curfew is based on what's been done in Massachusetts, where they put a curfew in place, and they put some other changes in place to protect the health of the community of the individuals in Massachusetts. And so we really want people to understand that's where we're coming from in Nashua. We do need to do something to protect the vulnerable populations in our community. Nashua is right on the border of Massachusetts. And so when things shut down in Massachusetts, we do see an increase in activities in our state, just along our border towns, which Nashua is included. So we want people to consider all of those things as well. I do know that Kim Bernard, our chief nurse, has a little bit of an update on the changes that occurred the mayor just announced in Massachusetts. That is going to impact us here in New Hampshire, and it is going to definitely impact us here in Nashua. Dr. Sturz, if Kim could share those few new things that have come up, and Ren also has some additional comments as well based on what we've been hearing from the health officers in the towns that border Massachusetts.
Thank you, Bobby. Kim, are you on?
Yes, I'm here, Dr. Storrs.
Hi. Can you go ahead and tell us what you know?
Sure. So I just wanted to give a quick update for those that may not have heard the updates from Governor Baker from Massachusetts. So due to the new infections and hospitalizations since Thanksgiving holiday, the state of Massachusetts has gone back to step 1, phase 3 of their reopening plan. And the reason this is important is, like Bobby was saying, we are a border city, and these changes can potentially affect us and our citizens here in Nashua. We have been seeing that we're having Massachusetts residents that do come up to New Hampshire, and with these restrictions, we could see that increase. Some things to note is that due to their reopening plan changes, there are closures to some businesses, and some of these businesses do include indoor performance venues and certain high contact indoor recreational businesses. They've had reduced capacity in many of their places of business from 50 to 40%, reduces in outdoor venues down to 50 people. I believe it was 100 prior. And if they have any sort of outdoor activities with more than 25 people, their health departments need to be notified. Restaurants and other venues, now there's no music allowed at these venues. There's a 90-minute limit, and there's 6 people per table at the restaurants and venues. And like us mask use.
Look at this guy. This guy looks like he's ready.
Oh, sorry for the interruption, Kim. Whoever
That's
that is,
okay.
can you put it on mute? Kim?
I think they did.
I'll try to stay on top of that, Dr. Sturz. Sometimes when people sign on, it automatically signs you on with your mic open.
I understand. I understand it's an accident. Kim, go ahead and finish.
No problem. I was pretty much done. Those were just some things that I felt were important to note. And these changes back to the step 1, phase 3 will be starting on Sunday, the 13th. So just some things to share.
Thank you very much.
Thank you.
First, Stephanie or Chuck, comments on Kim's presentation?
Well, I'm looking at the mass guidelines as we speak, and I'm looking under restaurants. So the new one that I was struck by must impose a 90-minute time limit. No music, as she mentioned. Food courts should be closed in the malls. So, and obviously wearing masks at all times. So, and they've gone further with all the outdoor activities, or the gyms and the other recreational venues all need to be places of worship. From 50 to 40%, libraries, museums, retail. So, and very inclusive. And I was impressed by that step. And, I would be 100% behind a similar action here.
Okay.
On another topic, if you get to that.
Okay. Stephanie, you good?
So I just want to be clear that we're talking about doing something differently, not just because Massachusetts has closed things and we think that people might travel here, but also because in the state of New Hampshire in general, and in our city in particular, the level of COVID is high. And lowering that is key to reducing the spread and making sure that the hospitals do not become overwhelmed and are unable to service the needs of our community. In Massachusetts and in Rhode Island, they are standing up field hospitals again. And that is indicative of the level of spread. And we know that we're only in the beginning of the cold season, when there's more indoor activities, which we know is higher risk than outdoor activities. And we also know that there are some holidays coming up where it's very hard to think about not having large indoor gatherings. And if we're starting where we are now and there isn't a change, then the trajectory will be very severe and will impact the community in a way where we will not have an opportunity to make decisions, but decisions will be made for us.
Okay, thank you, Stephanie. I believe I saw Ren's hand up a second ago. Ren?
Thank you very much. Yeah, I just wanted to add a little bit on to what Kim was saying and what was kind of talked about the impact of the changes in Massachusetts as well as the curfew that's down there. Heidi and I do meet with the other health officers in the state on a like regular basis. And last week we did meet with a few of them, ones in Salem and in Plastow, ones that are fairly close to the Mass border. And they are also seeing an impact as we have in terms of an influx of folks from Massachusetts up to New Hampshire since they are closing early. So we do know that that impact is happening. And as Kim said, there are the restrictions in Massachusetts, and I know there's a lot of business owners that are on this phone call, and a lot of restaurants that will have an impact based on the talks that are happening. So I do just want to kind of highlight a couple of the differences between Mass and New Hampshire. The last update to New Hampshire restaurant or for food service guidance was on October 30th. So it has been a while, and the only change at that point was the requirement for the sign in and dine, which we talked about in a previous meeting. Indoor singing with either a disc jockey or a solo artist is currently allowed under our guidelines. That's not allowed in Massachusetts. We are open at 100%, which I think any restaurant owner on this phone knows is not accurate, because that 100% does have to include social distancing or barriers in place, and those barriers cannot be used in bars. I think bars are probably more of a primary area of concern, and not so much dining rooms as an area that tends to have a lot of people. And I think a lot of restaurant owners on this call would also say that they're not even seeing the volume that they would, even though they can have that 100% with the social distancing and the barriers. But it certainly is a concern as people are traveling upwards. And even though there may be a restriction of travel from New Hampshire to Mass, again, these are things that are great words, but nearly an impossible thing to enforce, right? There's nobody sitting there, looking at who's passing where. So it does become a incredibly difficult task. And I also do just want to say, as I have in the past at the restaurants, many that we've worked with here have done a fantastic job by and large at trying their best to enforce the guidelines that are out there. Although some of them do have challenges, and we certainly do have the bad actors within Nashua. A couple nightclubs and a couple areas that we have worked with the state to enforce the challenges that we do see here. But in terms of looking forward, as was said, we are on the cusp of what's probably going to be the most challenging couple months of the pandemic. Cases are on the rise. Hospitals are getting slammed. Death counts are also on the rise in New Hampshire. I believe it was stated, not on this call, but in the news recently, just the first week of this month, we've had almost 40 deaths in the state, which is about 7% of the entire deaths that we've had in our state since this has started. And it really is about the same that we'd see in the entire year of an average flu season. So we know that the impact is here, and we have yet to see the impact of the Thanksgiving surge. And also we are heading into Christmas and into New Year's. So we know that this impact is going to get worse. So anything that we do, even though there's not a science, and maybe in some things in terms of curfews or travel, but we do know that I think a statement has to be made, and it has to be clear that we are having a tough go at it than we've had previously, even as a small state, and that this will get worse moving forward. Thank you.
Thank you very much. First, I'd like to say, and apologize, I only have 16 views on my screen. So some of you who may be raising your hands in the other screens I can't see, from time to time, Bobby will tell me, or I'm just going to let her have some control because I want to get some more input on it. I think first on that list that I have is Kurt Matthias. Apologize if I mispronounce your name. Kurt, are you there?
Yes, I am.
Go ahead.
Hi, my name's Kurt Matthias. I own Boston Billiard Club over on Northeastern Boulevard in Nashville. I guess my question to the group is, what are we trying to accomplish? Did I lose the connection?
No, is that the end of your question?
Hello? Okay. No. And restaurants, most restaurants within New Hampshire and even in Massachusetts do less than 15% of their business after 9 p.m. COVID doesn't stop spreading or start spreading at 9:30 p.m. Restaurants in general, and I'm speaking for myself, have done the best job we can to follow the governor's reopening guidelines. We too have had the imposition of a 90-minute maximum for customers to be in the building, social distancing, air exchange changes. To ask a business to close at 9:30 p.m., most businesses, most restaurants right now, we're all hanging on by a thread. You did an unbelievable job opening up Main Street, letting outside dining expand. We are not the problem. Everybody blames the restaurants and the bars. And yes, I'm sure that it gets spread somewhat in restaurants and bars, but it doesn't get spread any more in restaurants and bars than it does at Market Basket or at Home Depot or Lowe's or the liquor store. Everything that gets to run at normal, but it always comes back to restaurants. And I think it's grossly unfair that we now are going to have another restriction of being closed at 9:30 p.m. It just makes no sense whatsoever. I don't know if any of you have questions for me. I'll be glad to answer them. That's my take on the situation.
Okay, let me just put some ground rules down first. We have over 100 people on the line, and it would be totally unmanageable to have somebody talk for unlimited amount of time. We wouldn't get through what we're doing. I know this is not a filibuster or anything like that, but we want to hear people. I guess my job is to make sure that and no question, this is not for you, Kurt, at all. But we don't want to rehash the same things again and again. I want people to talk, but also to bring in new information. And that's the best way that we can control it. I would ask Stephanie or Chuck, do you want to address Kurt's first question and main question, and that is, what are we trying to accomplish?
At some point we may, I'm sorry, go ahead, Chuck.
Oh, no, thank you. Kurt, I agree. I don't disagree with you on the one hand. However, most people at Lowe's or Home Depot are not sitting in close, intimate contact like they are in restaurants, and they're constantly, hopefully, moving, apart from when they're in a queue or line to exit or enter the building. And those are bigger avenues, I guess. I have never been to your wonderful establishment, and I don't think the Board of Health has ever seen this as picking on the restaurants or businesses, because our modus operandus has always been and will continue to be just the general health and wellness of everyone involved. And that health and wellness not only includes the physical health, but emotional, economic health, all those things. So I think we're coming at it as, we're trying to figure out some strategy that works. I agree the virus doesn't stop spreading after 9:30, but we're not typically congregating in aisles at Hannaford most of the time. They've instituted their pathways and one-way system. So, I think, again, I thank you for your input, but I think I just want to make sure that everyone on the line hears that the Board of Health and Public Health Department are just literally here trying to navigate a sticky journey that we're just flying by the seat of the pants some of the times. But it's all based on science. So and the science is changing, as Dr. Wolf Rosenbluth had mentioned many times.
May I respond, sir?
Um,
And I'll leave it at this. I know that you've got to get to other
May
people.
I make,
If we
may I-
close Nashua, people,
Kurt,
go ahead.
we can't do that because we'll be here all day.
Yes.
Of every person. I'm going to let it happen for you because I didn't kind of lay the rules down before. Go ahead and respond to Chuck, but Stephanie has something to say too. You may want to wait until she says what she says.
So if you don't mind,
That's
Kurt,
fine.
Okay.
first of all, I'm going to start with an apology to everybody on the line. I have patients at 1:30 and I was not able to move that patient, and I need to be respectful to that individual. The second thing is that I want to thank you for all you do for this community. Each of us are living in Nashua with our families, and I know that all the things you do for all the charitable organizations in this community, and believe me, those kinds of things are on our minds when we're having these discussions. You had 2 questions, and I want to answer them directly. And then I think it would be great if we could get as many short comments in and then try to address one. What are we trying to do? We're trying to reduce the number of people that get COVID because some people, even young people, have permanent heart damage, permanent brain damage, or die. And the second thing we want to do is make sure that what happened in Italy at the beginning of the pandemic, and by the way, the numbers across the world are much worse than they were in the beginning of the pandemic, which is they ran out of beds, they ran out of staff, they ran out of equipment, and they had to start making life and death decisions based on things that I, as a physician, never, ever want to be involved in my lifetime. There's a fundamental, to your second question, there is a fundamental difference in restaurants and bars. You take off your mask to drink or eat. You don't do that at a market basket unless you're sticking your fingers in the pie, which you shouldn't be doing. So that is an absolute fundamental difference because the mask is what is protective.
Thank you, Stephanie. Kurt, I'm coming back to you because I promised to. You two, if you want to say something, go ahead. Otherwise, we're going to move on.
One quick thing.
Sure.
If we close restaurants at 9:30 in Nashua, they're going to go to the restaurants in Merrimack. They're going to go to the restaurants in Bedford. They're going to go to the restaurants in Manchester. If this is a decision that needs to be made, it's a decision that needs to be made statewide, not just single out the restaurants of Nashua. That's it. Thank you for your time. I apologize for monopolizing. Thank you all. I applaud the work you're doing. You guys are doing an amazing job. Thank you.
Kurt. There was no problem at all. Alderman Klee, I believe your hand was next up in the queue.
Thank you very much. And I'm not going to speak long. Truthfully, I think you as the Board of Health need to make whatever recommendations that you need to make. That's what we ask of you. We ask of you to look at the science and to make the recommendations based on that. We need to consider how, I think, based on your recommendations, I think you need to look at the science. I think it then needs to go to the Board of Aldermen as through your recommendation, and we need to consider how it can be implemented or can't be implemented in total or part. And I think that that's what our responsibility is, and to look at the laws, et cetera. I think you need to do what you're doing. I may or may not agree with your decision, but then it has to go to that. I do want to put in that I'm concerned about certain businesses such as Mr. Mathis and things like Mr. Rafferty and so on. Their businesses actually start after like 9:30 at night. That's really when things kick off. I would prefer to see more monitoring. In other words, if that means staff have to show up at these places, not just because they've been reported, but periodically show up. I think we talked about the old clipboard kind of thing. You know, someone shows up with a clipboard and talks to people. I think we've gone past the point of educating. I think we need to really work hard. I think we need to, and I'm not saying restaurants, I'm not saying the charitable casinos. I'm saying every place. Businesses in general. I get on a regular basis people calling me and saying, I went to this business, I went to that business, and no one had a mask on. I can tell you I've been to places, done takeout, and the person came to me with no mask on. Really, I turned around and told them, keep it, and then I contacted that for my money to come back. That's how I enforce it, but I have no problems reporting this and so on. My concern is WMUR, just I think it was yesterday, released numbers that many of the hospitals are going to have to increase capacity because of the surge. And that scares me. And that scares me a lot. I know people that are hospitalized right now, and they're going to be there for quite a while. And I know people, Dr. Stephanie Wolf Rosenblum commented on, and that is that there's the long-term effects. I know people have heart conditions, and she mentioned brain conditions. I actually know someone whose brain has now been affected by it. So this scares me. So I really want to hear what you have to say, and thank you for doing the job you're doing. And I think we as a community do have to listen. And maybe we have to take more personal responsibility. And sadly, I'm not seeing it 100%. So thank you for letting me speak.
Okay, thank you. I am going to start opening it up to people to talk 1 or 2 minutes. Okay, and I'll kind of give you the cut sign because we don't want to cut other people off, and we can't be here all day either. James, I think you were next up in the queue, if I'm not mistaken. No last name, so hopefully there's not more than one James. Would you like to speak?
James Rafferty here, the owner operator of the River Casino and Sports Bar. It's absolutely true that all businesses don't operate on the same schedule. We get busy at 9 o'clock is the time when we start to get busy. So a curfew that started at 9:30 would just really hurt our business. I am asking the Board of Health, and I totally support the mission and appreciate what you people have done. But, you know, any broad stroked curfew kind of, I think the time's passed for that. If we look at really effective, we look at effective measures that have been taken. I don't see a lot of that in curfews, and I just think they're going to go and hurt my employees and hurt people who are trying to make a living, and we need that to happen. The economy is so important. We need to put that in the front of our thinking. So I appreciate what you're saying. I'm going to cut this short because I know everybody wants to talk. Thank you, Chairman Tony, and good luck.
Thank you, James. I appreciate that. Again, I believe I have 2 people that one I saw was Dan. No last name. Again, hopefully there's only one Dan, and thank you for not giving me your last name so I didn't screw it up. So Dan, you're up.
Thank you. Quick 2-part question. One, is this to essentially deter Massachusetts people from coming up? And the second part is, what enabling statute are you relying on for the legality of your curfew?
Thank you, Dan. Well, one of the things, if we're looking at enabling statutes, luckily we have Attorney Bolton here, who is the city attorney. Mr. Bolton, could you address the second part of that question, please?
New Hampshire RSA 47:17.
Well, I would add that that's the specific enabling statute for everything. Is there a specific part of 47:17?
Subsection 15.
Thank you. Okay. I hope you understand what he just said to you. Is this to deter Massachusetts? It's certainly one of the things that's on our mind, but Chuck, do you want, because you know a little bit about Mass, do you want to speak to that?
Well, I don't have the good answer here because I agree the border's not going to close unless we have a big wall, and we don't want to go down that road. And I'd be curious about Ren and the meetings of the other cities on New Hampshire border. Did they have any, I'm not trying to pass the buck any, did they have any ideas on their docket in terms of what they thought could help, or did you gain any information that you could share with us?
I'm sorry, Chuck, who are you?
Oh, was I mute?
No, I was, who are you directing?
to Ren or Heidi if she's on.
Thank you.
Yes, thank you. So that conversation was part of a conversation that the health officers were having with the state, the director of public health, Director Lisa Morris. We were talking and trying to really strategize a effort more statewide that could kind of help out areas of need and looking at the support structures that health officers need. Because there's only a few of us, like our staff here, we cannot be at all places at all times. We're already working 7 days a week, round the clock. Just in terms of food service, we license over 530 places, and that's just food service. We're not talking about just general retail stores or anything else. And with only less than a handful of staff, that's a impossible task to try to go out and do these compliance checks. So although we were talking about efforts the state could do to increase funding or task force for health officers to help to address some of these concerns to be more present out there, was one of the avenues that we were looking to go down. But again, this is something where there's no easy answer. Things are moving way too fast, and they were certainly seeing impacts on the border towns from Massachusetts, as well as just general widespread of like COVID in their towns, meaning that case counts were rising just as sharply as they have been here in terms of how many people that they have.
Thank you.
Thanks, Ren. I think, Kim, you were there. She beat you, Bobby, so go ahead, Kim.
All right, I just wanted to respond. When I brought up the information regarding Massachusetts, and Dr. Stephanie did speak to this, but I just want to reiterate that I'm bringing it up, to give this information so that we're aware of what another state close to us is doing. The other reason is because their mentality is that they're trying to, respond to the new hospitalization rates as from the Thanksgiving holiday. And also all the new case counts. So we are trying to look at what we have as well. So that was another reason why I wanted to bring that up. Just to give you an idea, from October to November, our case counts have tripled from a data perspective. So I just wanted to just respond to that.
Thank you, Kim. Joe O, I'm impressed you've had your hand up for at least 2 hours and it hasn't moved at all. So I'm going to give it to you.
Hi, folks. My name is Joseph Olaforovich. I'm with the First Church of Nashua. I work for a religious institution in town that has taken Dr. Wolf Rosenblum's 4 major points that she mentioned at the beginning of the meeting of safety and actually integrated them at or higher than the state or CDC guidelines. So it was nice to hear her outline the 4 major points of social distancing and hand washing and air ventilation and those things. I'd like to ask the board, when I heard Mr. Bodewin say that even there is no science on curfews, as Dr. Wolf Rosenblum also said, there still needs to be some sort of statement. I would hope that the health board would make a meaningful change to something and not just do something because they think something needs to happen that may not be as effective. I am curious if the health board could provide the information to venues such as ours and to everybody in town, this person to cubic feet ratio that Dr. Wolf Rosenblum mentioned. I think that would be very helpful information to have regarding the air exchanges. Then 3 questions. Is the Nashua Field Hospital gone? Just wondering about that regarding capacity. Has the health department revised its own stance based on CDC revising its surface contact guidelines regarding COVID transmission? And do you believe that the mask wearing that is unprecedented will have a great decrease of cold and flu spread anyway in the middle of this time? Those are my 3 questions. And I've written them down so I can remember them in case somebody.
Thank you, Joe.
Yep.
Ren, I'll have you hit the first one, second one, I'm sorry, surface contact guidelines.
Yeah, so let me hit on that point real quick. So the guidelines themselves, at least in terms of the survivability of virus on the surfaces, hasn't really changed. but the understanding of transmission has. So they're seeing it's more and more less likely that that is a primary mode of transmission. The virus is this like envelope virus. It does die easily with like cleaning products, and really just grit to essentially wipe it off of a surface. So in terms of contact surfaces, unless you're more so in direct contact with a known person's, like let's say, snot on a tissue, if you're in that direct contact, that's obviously a much higher risk, but just general surfaces don't seem to be a very, very high rate of transmission, although still possible. And in terms of the cubic feet per person, that has a lot of variables that are in there. It's not easy math. There's a lot of factors that play in. So unfortunately for that, there's no easy answer.
Thank you.
Very good. Bobby, could you answer the field question?
Yes, I will, and I'll be brief because I know that Aaron P. has his hand raised as well. And I wanted to answer the other question. So the reason why we're having this conversation is not just because Massachusetts put a curfew in place. They put a curfew in place so they could slow the spread of their virus, not because of any other states around them, right? They're doing that for their community. And so that's why we're having this conversation as well. What are some of the things that we need to do? And it's not to, punish our businesses at all. In fact, it's not so much the businesses as much as it is the activities that people themselves are doing. And so those 4 points that Dr. Wolf Rosenblum mentioned about the masking, the hand washing, the not going out when you're sick, those are the things that are really important. And when people don't do those behavior changes, and then they go to your businesses, that's when the virus takes advantage of the opportunity that it has to come into contact with more bodies. So when there's more bodies, there's more spread. All right, so those are the key things we want you all to think about. And again, I said, this is a collective thing that we all can do. So if our businesses are making sure that we're adhering to those things, then that's what allows for the businesses to stay open and operate. When there's enough spread in those businesses, it impacts the workers that are there as well, and then their families, and then their kids, and then the schools, and it's just a compounding impact that has on our entire community. So that's what we want you to keep in mind. With regard to the alternative care site, the state right now has 2 what they're calling warm alternative care sites that they have ready to deploy if needed. And that's going to be in Manchester and in Littleton. Our alternative care site has been taken down, and our hospitals are looking to try and maintain any surge internally, okay? And what that means is they have to have the staffing capacity and they have to have the room to do it. So right now they're shifting things around, opening up beds in other places because their ICU beds are starting to fill up. One hospital let us know on Monday they had 10 out of their 11 beds filled. That was on Monday. They also let us know how many emergency room visits that they were getting in the hundreds of people coming in, up to 40 people with COVID related illnesses. And so it could be pneumonia, it could be a cardiovascular issue, all the things that Dr. Wolf Rosenblum mentioned before, because COVID impacts our system, respiratory, GI system, cardiovascular system, and our neural systems. And so the virus itself, once it gets in, it does a lot of different things to different people's bodies. That then for some that have to be hospitalized, that's when we see the increase in those hospitals. So those are the things that we're trying to decrease, because our hospital staffing has been taxed. Our nursing home staffing has been taxed. And for the most part, what we were learning was that people were not getting infected at work. It was the activities that they were doing outside of work that exposed them to the virus, and then they're taking it into those other places. So that's why we're looking at what are things that we can do as a community, as our businesses, what can we do together to help decrease that exposure and that virus spreading during the activities when people are in crowds gathered together, either in your restaurants or in your bars or wherever they are. So the masking is important. If you have to turn people away so it's not so crowded, then, is that something that you could do at your businesses? How do we work together to stop the spread of this infection? And sorry, Aaron, that took longer than my quick little time that I thought it would.
Okay. Alderman Lopez, I recognize you, but I'm going to ask Aaron, who's been on, had his hand up longer, and then you're next. Aaron, thank you, Tom.
Mine was just a very quick question to Mr. Bolton. Could you repeat that RSA reference, please?
There we go. Okay.
Here I am. RSA 47:17, subsection Roman numeral 15.
50, 50,
15,
15.
XV.
Okay, got it. All right, that's all I needed. Thank you.
Thank you, Steve. Thank you, Aaron, for being patient. Tom, you're up.
Yeah, I just wanted to make some comments with regards to the overflow capacity, because I've seen a lot of people asking about the alternative care sites and if there's additional ICU capacity. We really don't want to be thinking along those lines. We don't want to be looking at, cots in a gym as though they're additional hospital space to take on people who are sick and dying as a way to permit additional evening recreational activity. I understand that people are struggling economically, and that's an issue where we really need to be looking at the state, and we really need to even be looking at the city level to provide alternate means of funding, both for small businesses and individuals working at small businesses that are being unfairly impacted. But you can't look at extra garage space when your living room's on fire and say, well, can we just move over there? You kind of need to look at the actual symptom and look at what is happening to you. And I know Massachusetts isn't just making curfews because they enjoy making rules and laws and crippling their own economy. I think they're making the rules and the curfew because there's a massive outbreak taking place over there, and they already learned with what happened in the spring not to let that unfold. Rhode Island is likewise running out of capacity. This is sweeping the country. It's not unique to New Hampshire or anybody else. So far, New Hampshire's been doing very well because we've been proactive. So I think, number one, we need to not be looking at how many safety nets can we fall through before we really hit the ground. But then number two, I think as aldermen, there's a lot of aldermen who are here, so I hope all of us are committed to looking at other alternatives and other mechanisms in addition to just public health, because only looking at this as a public health issue forces all of this conversation to be happening at the Board of Public Health, when we should be having a much more robust and significant economic development leadership role taking place here in a different setting, where we're focusing on how do we help small businesses and what are we doing to make sure that people who are having trouble paying rent and utilities and those things actually have access to and the support that they need to get through this. So those are my comments. Thank you.
Thank you, Tom. I'd like to jump over anybody that's in the queue to Stephanie, because she has to leave in a few seconds. Stephanie, go ahead.
Thank you so very much. Alderman Lopez, thank you so much for your comments. They're certainly reflect much of our concern and discussion. I would like to comment on a few things that have been brought up, but then have one recommendation as the conversation continues. One is, there were two questions earlier about why is Nashua doing this? Why isn't it the state? And our role is the Board of Health in Nashua, and our public health department are focused on Nashua. So that's why we're here having this conversation, but it's important for people to know that we have reached out to the state. We are trying to meet with the state. We have shared our concerns. So we're just trying to make sure that we are fulfilling our responsibilities to the citizens of Nashua. Speaking of the implications, not just around COVID, but in Massachusetts, they just announced that they will be reducing the number of elective procedures and elective cases so that they have hospital capacities for COVID. For individuals that have been waiting months for a hip replacement so that they can walk and work, I want to make sure people understand that there's a trickle-down effect for a lot of people with other conditions that rely on equipment that is being triaged to help people with immediate needs. That needs to be considered as well. We would welcome the opportunity to work, as we stated last time, to work on a regular basis with the health department and with the businesses to try to maximize the safe environment, because this is all about risk reduction. there is no such thing as any activity that will not present a risk of COVID. But there are certain activities that, as discussed, I won't reiterate the things that we know work, that are higher and higher and higher risk. And the CDC has a very nice table that shows the different levels of risk that should be considered. One of the things that was said at the beginning really caught my ear, because this has been a great concern of mine. And that is that we know that singing, loud talking, and live entertainment is exceedingly risky, because the virus particles and travel on droplets, not just the aerosol as Ren described, but it can be 25 or more feet. And at the very least, part of our recommendation should be that for the current time, live indoor entertainment should not take place. That is my personal recommendation. And I apologize to all that I am not able to stay on this call, but I will remain available later in the day and to the board for their next meeting. Thank you, everyone, for the thoughtful conversation.
Thank you, Stephanie. Happy holidays.
Thank
If we
you.
don't- Okay. I'm not seeing any hands, but that means 16 people out of 100 is what I see. But I do know Bobby has a letter to read into the record. Go ahead.
Yes, and I don't see any hands either, Tony, so I will go ahead and, for the record, there was a communication received from Miss Paula Johnson, and she asked that the letter be read. She does have some attachments of some articles that make it extend to about 6 pages, so I'll just read the content of her letter. Curfew mandate and update on mask in opposition to a curfew in Nashua, from Paula Johnson at 15 Westbourne Drive in Nashua, New Hampshire. Dear Mayor Donchez, Director Bobby Bagley, and members of the Board of Public Health and Board of Aldermen, I am unable to attend your Zoom meeting because I have a previous work commitment. I have to report so I can get paid to continue to have a roof over my head, food on my table, bills, pay my bills, and property taxes. You see, my husband and myself are deemed non-essential. I was out of work for 11 weeks and my husband for 6.5 months. I hope that you will read my comments into the public record, as I have collected information from many sources. I do find it very disturbing that City Hall and many other city departments within the city are open, but not to the public. There are department directors that direct from their homes and only rely on their managers to supervisors to oversee the work that's being done. Now, how effective is that? Some people are deemed essential, are working from their homes. How are they essential? Only in government can this happen. If you're afraid to come back to work, then maybe this is not the job for you anymore. I've been back to work since May 28th, and I work directly with the public and have to work with a mask that is impacting my health. Since this COVID-19 pandemic attacked this nation, we have seen the devastation continue with families, students, and businesses. How can we impose a curfew and continue to control people's lives, as this is not consistent with the New Hampshire slogan, live free or die, or our right to assemble? Riots and looters don't have curfews, but incident people have to be subjected to a curfew. How does the Board of Aldermen relinquish their duties to a non-elected director and appointed board to make unilateral decisions for the city? As I have researched many websites and have read more about COVID-19 than anything else, I'm very concerned about the overall mental peace, not just for the adults, but for children. Studies have been written, not just in adult, but children, alcoholism, drug abuse, domestic abuse, and yet the medical profession and politician feels that lockdowns and remote learning is the best. Can someone please respond to my email regarding the following questions? The YMCA has been open since the pandemic attacked Nashua. Essential employees could drop their children off at daycare. How many actual active cases of COVID have we seen at the YMCA from staff and children? Number that has recovered, test cases that are negative. Has the Boys and Girls Club and Girls Inc. remained open? And if so, number of active COVID with staff and children with negative cases, how many recovered? Daycare centers, have they remained open? Number of active cases with COVID-19 with staff, infants, toddlers, etc., and number of recovered infants, toddlers, school age and staff. Thank you for your time in reading my information. Very truly yours, Paula I. Johnson, member of the National Board of Education. My opinions and not the Board of Education.
Okay, thank you, Bobby. Any more comments?
There are no hands raised at this time.
Alderman Schmidt?
Thank you very much. I wasn't going to speak. I just read on Facebook that there is someone with a bullhorn outside the mayor's office, apparently, his house, excuse me, apparently angry about the fact that this discussion is going on. I think that's a shame, because I think that if we can't discuss things, we've lost a lot in our community. Anyway, just a couple of questions. Do we know that 9:30, any kind of closing bars or restaurants at 9:30 would make a difference? Have we actually seen the numbers increase at some of these? And is there something we can do in the specific places where it increases rather than to put a general curfew on? And the other question I have is, are there CARES funds available for restaurants and bars to purchase specialized filtration systems? I understand that this is an extremely small virus. So it would require something more generalized, specialized. But is there money available to offer restaurants and bars some way to make sure this is clean? And the third question is that a lot of this is happening in small groups. A lot of transmission is happening in families, kids coming home from college. A curfew would not help this at all. And I know that this is frustrating as heck because this is how this contagion will continue if people don't realize that masks are important at home when the kids come home from college. That's all I needed to say, and thank you very much.
Thank you, Alderman Schmidt. I can't even balance my own checkbook, so I have no idea about money, but I'm gonna give this to Bobby, please.
Yeah, so just to answer those questions, just from information that I gathered from, and you know, DJ, I saw DJ on, and I hope he's still here, but DJ is actually from the governor's reopening committee, and you saw him responding in the chat. So if he's still here, DJ, please respond to parts of Alderman Schmidt's questions. With regards to the curfew, and has there been any data to show that there has been a decrease? For most of the states that have put a curfew in place, the curfew, as I think one of our business folks mentioned, was put in a little late. The spike had already started to happen, so right now it's hard to measure the impact of the curfew. And speaking with one of the directors down in Massachusetts, I did ask that question because, you know, I wanted to know what was the impact, you know, of what was happening in Massachusetts, because our business people wanted to know. And it was hard. It was hard at that time for them to give any data. It's only been a month since they've had the curfew in place, and they put it in right at the smack of the uprise of the cases. So that's going to be really hard to measure. With regards to money, is DJ still on? Okay, so I guess he must have gotten off. Again, he's with the governor's reopening committee, and I did invite him to attend this meeting. In speaking with DJ, I did ask about funds for businesses. And the reason why our governor has not made any changes to shut things down in our communities because of the impact that the shutdown had on businesses in March and April. And because it was such a hard hit, there is a hesitancy to do that again, because right now there are no additional funds coming from the federal government to provide that support. Now, if that's changed since the time that I spoke with DJ, I'll get more information on that, but that was what was provided. He must have had to get off the call earlier, or that would have been part of what he would have shared as well. So at this point, from the federal level, until there's more monies available, our state doesn't have any more monies to give to our businesses that I was informed of.
Okay, thank you, Bobby. Any other questions or comments? Brandon?
Couple of hands. Aaron and then Alderman Lopez has a hand.
Well, Brendan had his, and he got first pick. Go ahead, Brendan.
Hi, thank you. So I just wanted to, first of all, thank everybody for having this conversation. I feel partially responsible for moving this conversation along during Thanksgiving week because I was so scared that it was going to contribute to numbers spiking. And lo and behold, numbers are spiking. I just wanted to state for the record, I am against having a curfew because I don't see any information that makes it seem like it's going to do anything to curb the numbers. I think that what we really have here, and I may be mistaken, is a problem with enforcement. We're trying to change people's behavior and get them to start doing the things that we've been telling them to do for the last 8 months. We need to start finding people. We need to start holding people accountable. If someone goes into work and they know they're sick, we need to start charging them with criminal activity. We need to start going into businesses because it's at the point now where the businesses that aren't making their customers and their employees follow the rules, they're hurting the rest of us. Like, we're having this conversation right now because those businesses aren't doing what all the other businesses are trying to do. So that's the angle that I'm taking right now. I mean, when this comes to the Board of Aldermen, I anticipate we'll probably talk about this for another 5 hours, and we'll see what happens there. But I am not going to advocate for a curfew. I think that it would, I mean, I work with 10 people at my bar. I think 5 of them wouldn't be able to pay their rent this month if we had a curfew imposed. So, and that's just one business in Nashua. So unless there is some kind of economic fallback to help these people when they get put out of work, it's going to cause more chaos than anything else. And as you know, as medical professionals, poverty, homelessness, those put a pretty big strain on the healthcare system as well. So we don't want to exacerbate the problem while we're trying to fix it. So that's all I have to say for that. I really appreciate all of your time. Thank you very much.
Thanks, Brendan. Aaron P.
Yeah, just another quick one. And by the way, thank you very much for running this meeting the way you've done. It's been very useful. But Mr. Bolton, I went and read the RSA that you referenced, and I'm wondering how you think it does not conflict with RSA 354-A:16, which is out of the State Commission for Human Rights chapter. It's called Equal Access to Public Accommodations, a Civil Right. A curfew would seem to limit that.
I see no conflict at all. We're not saying that it would only apply to certain groups of people. We're basically saying it would apply to everyone.
That's exactly my point.
In which case, I don't understand your point at all.
All right, you might want to go look at that because I'm not sure what you're trying
I am very familiar with it, sir.
Okay.
Okay, thank you, Steve. I have Alderman Lopez. Ray, you can put your hand down. You're right after him, okay?
Okay, thank you.
Tom?
Thank you. I just wanted to remind the public in terms of roles that the Board of Public Health its role is to look at the health and well-being of Nashua and the immediately surrounding communities. The role of the Board of Aldermen is to do legislation and budgeting for Nashua. So we are looking at Nashua first. We are aware that we are in an imperfect climate, but our responsibilities and our authorities are specific to the Nashua area and people coming and doing business and engaging in activities within this area. Secondly, I would like to observe that there is data to suggest that a curfew might be effective because there's plenty of data to suggest that an empty room has a lower level of COVID spread than a room full of people that are unmasked and eating. And I think that's the entire concept here is reducing the amount of exposure is likely to reduce the amount of people who are exposed. I would ask the Board of Health to look at its recommendations specifically to the kind of super spreader events that Alderman Laws was initially concerned about with Thanksgiving, in the context of the days immediately before Christmas and the days New Year's, as potential targets of any kind of recommendation, just to kind of make it easier for the Board of Aldermen to discuss a more limited scope, because I think there's a lot of public comment about sweeping regulation and unspecific mandates and large non-specific approaches, where I think targeting high exposure behaviors such as eating or even drinking, people can use a straw through their mask if they want to, but largely won't. And even as was discussed earlier, the singing, if you specifically target the behaviors that provide the most risk and you do it in a minimum impact kind of a way, there are certainly going to be people who are disproportionately impacted, such as the river, which, if we do any kind of a curfew, they're going to suffer economically because they do a lot of business in the evening. But that may also make it possible for us to identify specific economic supports for them because they were disproportionately impacted. That's a discussion we need to be having with the Economic Development Director. He attended the previous meeting. I've attempted to reach out to him regarding this. There's confusion on the city level in terms of what state resources are available, most likely because there aren't any more that are available. But that doesn't mean that over the next couple of weeks, we're not going to have more become available as the greater scope of crises is recognized. I know Congress and the Senate are in the middle of debating additional COVID relief. That was the source of the original CARES Act support. We need to be looking at other avenues as well. If we have problems, we need to use the right tool for the job. But in terms of public health and public health outbreak, I would encourage the Board of Health to specifically look at what are immediate steps that we can take right now to prevent our emergency room capacity from overloading and our ICUs from starting to expand into other services that hospitals offer. As Alderman Laws pointed out, mental health is not to be taken lightly when it comes to economic impact either. And we already had a gross shortage of mental health support beds. I know that at the state level, COVID is impacting the number of available beds. I know that individuals going to the emergency room are finding it fuller than usual and finding less available supports than usual. And these are not conditions to be taken lightly. We've been experiencing a surge in suicides, a surge in domestic violences, difficulty accessing care due to remote support. So we need to reduce the impact on hospitals trying to provide acute care services, even if they're not, even if we don't have a high body count, we still need to be looking at how can we make sure that healthcare professionals are able to focus on the needs that aren't self-inflicted. So I think that's the recommendation that I'm looking for this board for providing. And I appreciate the conversations that you've led in trying to figure that out. Thank you.
Okay, I'd like to do a little bit of house cleaning because I know we got people in the queue and I just want to recognize them. But Ray, you're next. But one of the things that Tom said, he wished Tim Cummings was here. He actually showing up on my screen. So if he is here, we'll get his input. But right now, Ray, you got the floor.
Thank you, sir. Thank you for hearing me. I've heard a lot of people talk this morning or this afternoon and seem like everybody's protecting their turf. Like we say it's a bad thing, but don't have me do anything. And I don't want us to be unfair to anybody. But folks, we got to do something different. In the last 5 days, I read that 1 million people were infected. I don't have to be a doctor. I just know that this is going the wrong way and the virus is kicking our behinds. And we know the way to get rid of it is to separate. I'm not trying to hurt anybody, but just keep it simple. If we separate, we know that during the plagues in Europe, the people that stayed in their houses and refused to come out are the people that survived. So we have to separate. Don't want to hurt anybody's business. I had a person last Sunday that I prayed for in church. She was a nurse operating in one of these facilities. She literally broke down and cried. That's what's going on. While we're talking about money, and I know money is important, and I would vote for, people to get some sort of restitution. I'll vote for that in the future. But if we don't kick this virus's butt when it's at 1 million, What will we do when it's at 10 million or 20 million in the last 5 days? This thing is going up. It's not going down. And I don't want to take too much time. I'm done. I'll leave it there. And it's not a joke.
Thank you, Pastor Ray. Is that correct?
Minister Ray, but that's okay.
Minister Ray, thank you very much. I don't see Tim jumping up and down, so Alderman Clee, you got it.
I'm here.
Okay, you'll be next, Tim, okay?
Okay, thanks.
Thank you.
Thank you so much for taking my comments. I want to back the comments of my colleagues on the Board of Aldermen. With whatever recommendation you make, I know it will be based on science and logic, but I'd like you to consider not making it so broad sweeping as well, other than saying things like, perhaps the type of enforcement that we need to do, or which businesses, if they don't comply with certain types of regulations. I would rather see something like that. When the governor put through his mask order, he put a caveat in there that it did not overpower that which maybe some towns like Durham or Nashua have done. So he kind of gave us the power to do something like that. I just want us to be cautious, and I understand what Mr. Ray said about the we have to separate, and I think it was Tony Fauci that made the comment of that we can't control the virus, but we can control the spread of the virus. And the best way to control the spread of the virus is, as Mr. Ray said, is to separate and to not be here and to not go thing. As many people know, I had surgery yesterday on my hand. And if this gets much worse, somebody like me would not be able to have it. I know people that weren't able to get chemo treatments. We have to take all that into consideration. The person that's standing outside of the mayor's house with a bullhorn, harassing him and his wife and so on, that's not doing us any good. That's not helping the spread of this. We have to take personal responsibility. And if we don't, then places like the Board of Aldermen and the Board of Health have to come down with these laws and rules. I know I've spoken to Mr. Rafferty, who has put extraordinary measures into his place. I'd like to reward somebody like him rather than to punish. And this is not a punishment, but to have a negative effect on his business. So I would like to see us force every business to give us what is your plan of action if you have virus within your community, your business. If you're having people, say, restaurants or somebody coming in, what do you do? Last meeting, there was someone, and I won't point them out, it's in the record, but who, from a retail point of view, who said, well, if someone doesn't want to wear a mask when they come in, we try to get them to do it. Well, trying is not good enough. And I think Mr. Bolton was very specific. No, try enough. You will be held responsible. You will be fined. And I think that's really what we need to do. We need to be enforcing it, I think, as it was pointed out in the past. And I can tell you that while I agree with all the aspects of the curfew, the negative effects are the health of our people. And suicide is going up because people can't get together. And that's becoming worse because we're not following the rules. We're not following the science. I'm not preaching to the Board of Health because I know you all know it. I am preaching to those that are listening. But when you do make a recommendation, I'm going to ask that you be specific and not broad, and perhaps put in some kind of, if a business can give us the appropriate ways that they feel that they will keep everybody safe, and almost a promise that they may not be subject to the curfew. Just a comment, just an idea. So thank you so much. And I appreciate you hearing me out.
Thank you very much. I'd like to interject at this point to let you, can somebody mute, please? I'd just like to interject to let you know that Dr. Chuck has to leave at 2:15. So I'd like as many people to have a chance to comment that they possibly can, and I'll try to move it along a little bit faster. Tim, you were next up in the queue. There was a couple of things that Tom had asked specifically. If you don't remember them, I certainly don't, but if you don't remember them, we can always have Tom re-ask them. Go ahead, Tim.
Thank you. I don't remember them specifically, Mr. Chair, but first, can you hear me okay? I have an unstable internet connection, which is why my video is off.
Okay,
Can everyone hear me?
A little bit staticky, but I'm getting the message.
Okay, great. So I'll keep my comments brief. Again, for the record, Tim Cummings, Director of Economic Development. My response to Alderman Lopez is we are short on resources at this time. As we all know, Congress has not acted upon additional funding. Receive a recent loan program through an EDA grant that we will be getting up and running that small and independent businesses could take advantage of. And we're looking to get that up and running right at minimal supplemental resources available at this time. So that if Alderman Lopez wants to talk to me in greater detail offline, I'm happy to do that. We can kind of continue that conversation. My reason for speaking with you now is very simply to ask what the process is moving forward. I'd like to get an understanding as to how you foresee the way this public policy is going to unfold. Will there be additional meetings? Are you going to put anything in writing in advance before it gets voted on? I just want to get a better sense as to how you foresee, and maybe this is something that Director Bagley can address, but I would like to get an understanding as to how you foresee developing your written comments that you'll ultimately be making recommendations to the Board of Aldermen on, and what the timeline of that would be. Thank you.
Okay. Bobby, do you want to address that? I can only say this, that we're losing one of the members and we've already lost another member. So we haven't even gone into discussions on this, and that's only fair, taking into all the information that we have, plus the scientific information, and reviewing the numbers, both locally and people across the border, because we are impacted by them, either directly or indirectly. I foresee another meeting for sure, at least of the three board members, to sit down, talk it out, figure out what's right. I don't know, and I'd have to talk to Steve Bolton on this, but my understanding of this is we make our recommendations directly to the board. I don't think there's anything more to it than that. Timeline wise, I would say as soon as possible, because we're coming up on two really important things. One, students are coming back. We have the Christmas season, and then one of the more celebratory holidays of the year being New Year's. So we need to kind of get going on that. Bobby, would you like to continue?
Thank you. And thank you, Tim, for that process question. And so, again, the reason why we wanted to have this meeting, because we really wanted to have a conversation, have the discussion, hear from our businesses, hear from our aldermen, hear from our community members regarding this this particular issue of a curfew. So what we will do, as Dr. Sturris mentioned, is that we do have to have another meeting, taking into consideration all of the information that was shared. And that's why, you know, the time for public comment or to speak is now before the meeting ends, because all of that information will be taken into consideration. The other thing that will be taken into consideration will also be our data, as our data is really what tells us the story of what's going on. We also have to take into consideration what comes down the pike, you know, from the state level. And so all of those things will be taken into are the factors. And I think your input has been very insightful for the board. You've heard the position of the Board of Health members. You've heard some of the position of our aldermen that have spoken. And you've also heard the position that the Public Health Department is looking at as far as protecting of the health and safety of our community. And we do realize that a lot of it does have to do with, you know, the enforcement of what has been put in place. And so I think Dr. Sturris will plan for another meeting and again, take all these things into account before a decision is made, and then it goes before the Board of Aldermen. I think, Tim, you were asking if there would be an opportunity for this information to be shared. And I do believe so, Tony, that we can send out information prior to, you know, any final decisions are made.
Okay, thank you, Bobby. I'm now looking, I'm trying to kind of wrap things up if you can't tell. I'd like to, I see Reynolds. I don't know if you've got Vaseline on your camera, but
Yeah, I know. I'm sorry about that. I have an issue with the
Oh,
with
no
the
problem.
camera.
I didn't know if you were going incognito or not, but go ahead.
Yeah, I'm sorry. Yeah, it's blurred from cleaning with the wrong solvent. Anyway, I have no real skin in the game here. I'm a private citizen in Nashua, and I've been listening to this avidly for the last hour and a half. And I would like to say I have heard absolutely nothing, not one thing that tells me that it's a good idea to have a curfew in Nashua, other than the virus doesn't spread in an empty room. Fine. That doesn't help the people who are going to have problems with their jobs, lose income, and have to go elsewhere or figure something else out. I've seen a lot of that. I would prefer that we not even mention Massachusetts unless you all have shopped in South Nashua at the South Nashua Market Basket any day of the week and have seen that at least 50% and sometimes more of those cars are from the state of Massachusetts. Now you go in that store and you're walking down the aisles, you want to call it social distancing, okay, we're doing our best. But people are passing one another. Yes, as Dr. Capetta says, they're going quickly. They're wearing masks with creases in them. These masks are going to do nothing if they're too close to one another and one of them happens to be sick. I think you guys have done enough to the city. I think you've asked enough of the citizens. I urge you to forget about Massachusetts right now. Like I said, they've got approximately the 6th highest unemployment rate in the country out of 50 states. They've got a very high rate of deaths compared to ours. I'm one of many, 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 many citizens who are getting overwhelmed and tired of this. And I urge every single person who's listening to please read. I have a medical background, by the way, so I know a little bit about what I'm talking about. Read the Great Barrington Declaration, signed by over 50,000 physicians, health experts, health scientists. Read it. A curfew in Nashua at 9:30 is not going to do you any good. If you've got the numbers increasing, you're giving us numbers of 1 million, 1,000, whatever. Numbers are increasing all over the place of people testing positive. How many of those have died? And by the way, what are their ages? And if their ages are old, let's say most of the people who have died in New Hampshire are above the age of 75. Well, okay, keep them home after 9:30. How's that? And leave the rest of us to live our lives. I'm just asking you as a citizen of this city and of this state, we've had enough. Our restaurants have had enough. My neighbors and I have done our very, very best to do takeout as often as we possibly can to help these folks. And it's not enough. You're not going to have a super spreader in a restaurant. Let them go. I'm sorry for taking so much time. That's
Okay.
my opinion. I'm sorry.
Thank you for your input. Very passionate. I understand there are no easy answers here. If it was easy, we wouldn't even be here. Okay, so I do appreciate everything you say, as I do all the people that talk today. Are there any other questions or comments?
Yeah, this is Albert Todd.
Okay.
I called in a little late. I do have some comments. I do appreciate the fact that I hear aldermen speaking to the mental health crisis that's growing in this state. I think that's very important to take into consideration. I do appreciate the aldermen for doing that. My main concern is that what I don't know, like I said, I called in late to this, is according to the Census Bureau, we have 15% of our population that falls into the category of 65 or older, right? And that is what we're saying is the high risk category. What percentage of that population has contracted the coronavirus? Do we have numbers on that? And then my secondary point is that, like Alderman Clee said, this is having major impacts on mental health issues. Suicide rates are increasing. And I don't understand how imposing a 9:30 curfew is going to alleviate anything. One of the things that I would like to see the city take into consideration, like I said, I called in late to this meeting, is the occupancy of the restaurants and the bars and all these facilities that they plan on putting a 9:30 curfew in on. And the reason why I say that is because if the science says to wear a mask and the science says to a social distance, so why are we not breaking down the square footage of these businesses and making occupancy requirements based off of a 6-foot radius or a 6-foot area of what one person would carry? And that's one thing I don't understand. And at this point, I think a lot of the aldermen know my points of views on the curfew. And so I don't want to go too much further into depth on that. But I do want to say, as a veteran, that I find restricting movements on any body of people to be against our constitutional rights. And I would urge the Board of Aldermen, the Board of Health, and the mayor to do a poll and actually get a understanding of what it is that the public actually wants, whether or not a 9:30 curfew would be effective and how it's going to affect mental health, and bring our citizens into the conversation in the form of a poll in order to help alleviate some of the mental health issues that we have, and make the citizens feel like they have a say as to what is actually happening here. I think that that's very important.
Okay, thank you very much for your comments. Even though you might be late, they're important. And I don't have at my disposal answers to those specific questions regarding census, et cetera. I apologize on that. I do have another person up. Again, remember, if you have medical questions, you're kind of running out of time here. Robert? Bobby, is Robert still on the line?
I'm looking for Robert. I'm not sure if he has himself on mute or if he's on the phone. I can't see.
Okay. Anybody else? Comments? Questions?
Laura Cajon.
Go ahead.
Am I allowed to talk, Laura Cajon?
Yes, ma'am.
Okay, first I want to say that number one, the Board of Health is not my partner. The Board of Health wants to put a curfew on adults who have rights, and the Board of Health is trying to take those rights away. It's funny that the Board of Health is putting restrictions on residents and instilling fear. You obviously show that you really do not care about the residents and or any business within Nashua. The Board of Health just wants to make sure they are able to dictate to residents. You allow Walmart and other stores like that open, but you want to tell me when I have to be home at night? No, thank you. You say you look at science, but you people are not listening to science because now science is telling you the school should be open, but Nashua is still closed. The mayor put police at City Hall. Why not put police at Route 3 and not let anybody come up from Massachusetts? What will be next? Will the Board of Health is going to ask for martial law within Nashua? The Board of Health needs to keep their fears to themselves and let the Nashua residents live their life. We are all responsible Nashua adults, and we know what action we need to do in order to take care of ourselves. I am of the age that this virus is bad for my health. I am willing to take that chance because I feel it's in God's hands, not the Board of Health. And of course, it's going to get worse before it gets better. But you know what? That's how viruses work. All I'm asking you is to let people in Nashua live their lives and not try to dictate to everybody the way you are. Thank you very much.
Thank you. Paige, you had your hand up.
Hi, thank you for taking my comment. I am the manager of Panucci's Ale House downtown, and you know, we have enforced all the state and city guidelines. I think we've done it incredibly well. It is absolutely feasible. We have, on most days, doubled our payroll just to have people, employees available to enforce these restrictions. We feel safe as employees. We've had comments from customers saying they feel safe at our establishment. We have more than enough room between tables. We spent $50,000 on outside heaters on our deck. You know, where I can only speak for Panucci's, obviously, but we're doing about 30% of business right now. We did a little bit better in the summer, but the crowds aren't out. They aren't out. So the little money that we can continue to make till the end of the, normal hours is very important to all our employees. It'll be tough on a lot of my employees, and unemployment just doesn't cut it. So, and I also hope maybe the board would go out to a few of these places after 9:30 before you make a recommendation, to see what we're doing out there, to see that things do feel safe. And the places they don't, they should be cracked down on. All right, thank you.
Thank you, Paige. Robert, someone in my ear said you still have your hand up. Are you there? I guess not. Any last questions? Going once, going twice. I'd like to thank everybody for their input, for taking their time out of their busy schedules, especially with the holidays approaching. Wishing you all joyous and happy holidays. Hopefully this will be behind us. Hoping maybe the vaccine, a little bit of time and cool heads will prevail and we'll be out of this. But until then, on the Board of Health, we'll meet at a meeting, hash it around, come out with what our recommendations will be, and Bobby will make sure that those are distributed or available for the public. Thank you very much. Dr. Chuck, thank you for taking time out of your busy schedule. Bobby, somebody said Laura has her hand up, so she made it right under the deadline. Laura, go ahead.
Sorry, I was putting it up at the end a couple times and someone kept taking it down or glitched, sorry. I'm never comfortable giving these types of comments on, things like this, especially where I have such a strong disagreement with everything that's being discussed. I have stopped spending any money in Nashua since everything has started, because I have been physically harassed by employees at stores. My son has been physically pushed. An 8-year-old son has been pushed by an employee. We have medical conditions that we cannot wear a mask. We are now, with the mask mandate being revised, being told we have to supply papers. What I'm hearing from a lot of people on here is this extreme fear. And I just ask that you please stop pushing this fear among the citizens in Nashua, to where people are being so bold to go and harass other people for not having a mask on. The majority of people wear masks. So it should be under the assumption that the people that don't wear masks have a reason not to, and not to encourage citizens to come up to other people. I cannot no longer shop in Nashua because I will get harassed. I have a fear of police getting called on me. And let's be honest, the police do not have time to chase after people that aren't wearing masks. They should be handling the homeless problem. You want to talk about the homeless panhandlers at exit 6? They come knocking on my truck. They come knocking at everywhere. That's where the police needs to be. The mental health crisis, that's where we need our help. Not this mask, not a curfew. We have a free will. We are all adults. And I'm sorry, I don't want any of you in control of my health. I am in control of my own health. I have multiple chronic illnesses. I have fought and beaten cancer. I take care of my mother who has stage 4 pancreatic cancer. Do you think she wears a mask? She doesn't wear a mask. She gets sicker when she wears a mask. My father is a heart attack survivor. I work in the healthcare industry, and I just need to know when you're going to provide updated data, because some of the information I've heard is months old. And what's your end game? When is the mask mandate, because it's not a law, when is that going to be removed? What are you looking for? 0%, 1%, 2%? And when are you going to base it off of tests that are actually accurate? And what's happening with the flu? So I guess those are my questions. Is the flu all but disappeared? And what's your percentage rate? Because as of right now, I'm not spending a penny in Nashua, and that's hurting. And I know thousands of other people that aren't. And my husband and me would spend upwards of $5,000 a week for business. So you guys have taken that away from Nashua because you have encouraged people to bully me. And I don't feel safe going out in Nashua. So what are you guys going to do to make Nashua a safe place and where people can feel comfortable shopping here again?
Okay, thank you, Laura. Anybody else? Again, for the third time, I'd like to thank everybody for coming. We will, I guess, be in touch later. Bobby?
Yes, thank you. Thank you, everyone, for your input. And information will be posted on the city's website and at the library and distributed so that everyone will see the outcome of this meeting. Thank you, Dr. Sturrs. Thank you, everyone.
Everybody, happy holidays.